In the early days of HIV/AIDS, there was so much fear and anxiety among everybody.
People were dying left and right. We didn't know what was going to happen to our community.
Most Asians were quiet. They suffered by themselves because that was within the culture, that you bear misfortunes. The intervention team began because a group of us, my friends, Tack, Roy, Doug Chen, and myself, and a couple of other, like Andy Che, decided that we were seeing enough of the illness in our community. So the group of us started to meet in our living rooms as far as trying to figure out what we were going to do. I think the accomplishments of APIT was, one, we were able to hire the largest openly gay and lesbian staff here in LA. We had the first transgender prevention outreach program in LA. And that was Bionic Women's Campaign with Jordan Balza. She helped to solidify a transgender program. We also had billboards and bus stops where we saw Asian faces in their languages talking about HIV and AIDS.
Love Your Asian Body was really an example of how artists led and started the HIV/AIDS movement, and how the work of artists really results in generative public health.
Since the peak of the HIV/AIDS epidemic, APIT has been able to expand its services with a myriad of social support groups and an expansion in its HIV testing program, reaching more than just the Asian Pacific Islander population.
To be effective, you have to raise it across communities. It can't be just an Asian Pacific Islander thing, you know? The ethnic specificity is just not a good way to operate. And socially, it's not a good way to operate. You know, the way society is moving and trying to be more diverse, then why not us?
Clients that, have been around for a few years and are surprised at how far along the technology has come. The results take less than a minute. With the MTU, the mobile testing unit that we have here, we are able to go to different locations across Los Angeles County, find locations where we see our target demographic.
40 years into the AIDS epidemic, we know that the treatment approaches has evolved, and APIT has also evolved. So we're not just treating HIV, we're really treating the holistic care approach for our clients. So we may be dealing with the issues that they face, such as mental health or addiction, or certainly here, particularly in Los Angeles, the issue of homelessness or housing insecurity. That's how we've evolved APAIT and how we continue to make impact.